The following portion of Daytime is sponsored by Moffitt Cancer Center.
There are different types of cancer that can affect a woman's reproductive system, and the experts at Moffitt Cancer Center are able to offer the latest and most groundbreaking treatment options. Here to tell us about the research and work that's being done in Moffitt's gynecological clinic is Dr. Robert Wenham. Doctor, welcome. Good to have you here.
Thank you so much for inviting me, Maggie.
Let's begin with your specialty. What is a gynecologic oncologist, and what's the difference between a gynecologist and an oncologist?
Sure. Well, most people think of gynecologic oncologists as super gynecologists, but that's not actually the case. So a gynecologist will go through 4 years of additional training after medical school and learn a lot about benign gynecology, gynecologic surgery, and the management of women who have gynecologic issues. Gynecologic oncologists have completed that training. They go on to do about an equal amount of training after that in intensive complex surgical management, chemotherapy, biologic therapy, and the treatment specifically focusing more on oncologic and complex surgical cases.
So when you talk about treatment, if somebody's been newly diagnosed, what are the questions that they should ask before beginning or seeking treatment?
I think the very first question, now that I have a little experience behind me, is really asking where's the right place to start with this. When you're concerned that you have a cancer diagnosis, I feel a lot of patients feel pressured to see the first doctor available that's given to them. And really what you want to sort out is, where am I going to be treated? Who am I going to be treated by? What is their expertise? Do they treat the entire oncologic disease, or do they farm out to other people to take bits and pieces of it?
So why choose Moffitt?
Well, I think that's one of the things that Moffitt has. Our GYN oncologists there understand both complex surgical management, but also the complex therapeutic management of patients. And besides that, being a comprehensive cancer center and the only one in Florida, we have a number of other ancillary things that a patient may never notice in their care. For instance, all our patients are reviewed by a tumor board, which includes all of our colleagues, so we're all weighing in on things. We also have a genetics tumor boards. We have geneticists that are involved, and we go through everyone's personalized medicine profiles to make sure that they're matched to the right types of treatment. We have social workers and counselors. I've got so many resources available for me. They're all underneath one roof that we can really take comprehensive care of a patient.
And isn't that exactly what people need and want during that time, which is the worst time in their lives?
Absolutely. Some of the errors that I see, or missed opportunities I should say, sometimes have to do with just handoff issues and communication issues in medicine. And I think that having that underneath one roof, or even if I'm working with an outside oncologist, I can stay intimately involved and make sure that they're really getting specialist information. There has been somewhat of a trend in our field for some of the GYN oncologists to just do the surgery and then to send to somebody who may not have the specialty expertise in gynecologic cancers. And that's really somewhat of a mismatch. I really think every patient should have comprehensive expertise care. And
I know that you're always growing over at Moffitt. What are some of the exciting changes that are in store?
Yeah, so one of the nice things about being at a comprehensive cancer center is we're really on the bleeding edge of what's coming next. In fact, we help define that. Recently, we developed, through phase 2 and phase 3 trials, the ability to use a specialized dye that's given before surgery, and it binds to a particular molecule which you find on a lot of ovarian-type cancers. And so during surgery, not only do we use our eyes and our hands to find tumor to take out, but then we can use a near-infrared camera to identify other lesions. And what we've found is about a quarter or a third of women will actually find clinically significant lesions that we would have missed otherwise. And so we were able to get that through FDA approval, and now it's become part of clinical care, and we're one of the only few places that have that to offer.
Congratulations, and thank you.
Yeah, it was a big step.
Thanks, doctor.
There's many other exciting things going on. So patients are there and available to participate in some of the leading edge clinical studies. And we have seen the progress of improvement in survival in ovarian cancer quite dramatically over the last 5 to 10 years, and all of that has been for patients who have initially gone on to clinical research.
All right, Dr. Robert Wenham, great to have you here on Daytime. Appreciate your time, and if you'd like more information, you can visit moffitt.org/outcomes. Daytime will be right back.
The preceding portion of Daytime was sponsored by Moffitt Cancer Center.